Good afternoon. Bon après-midi à tous. On Tuesday, we further reopened the province by lifting all remaining indoor capacity limits for public settings and removing proof of vaccination requirements. We were able to do so because of continued improvements in key public health indicators, though we are monitoring some regional variation, particularly in the north. Mardi, nous avons rouvrir davantage la province en levant les dernières limites sur la capacité à l'intérieur des endroits publics et en éliminant les exigences concernant la preuve de vaccination. Nous avons été en mesure de le faire grâce aux améliorations contenues des indicateurs de santé publique clés, bien que nous surveillons certaines variations régionales, surtout dans le nord. The percent positivity is stable, and new admissions to hospital and ICU have been declining. We recently saw a 25% decline week over week for new COVID admissions into hospital. The unvaccinated continue to make up the majority of COVID-19 cases in intensive care. These individuals have much higher rates of hospitalization, ICU admission, and death compared to those fully vaccinated and boosted. We are also seeing continued decrease in the number of outbreaks in high-risk settings, such as hospitals and long-term care homes. We are paying close attention to our wastewater surveillance, which has emerged as a key indicator to track transmission levels in communities. Most sampling sites in the province are still showing a downward or stable trend in COVID detections, but we have been closely monitoring regions of the province where there have been early indicators of increasing trends. We will closely monitor for any new variants internationally and are tracking the presence of the growth of Omicron subvariant BA.2 in the province. While BA.2 is very similar to BA.1 Omicron subvariant that is currently dominant in Ontario, we know that it is 30% more transmissible and will likely become the subvariant in the coming weeks. Although we have lifted most public health measures, masking requirements remain in place for now. Bien que la majorité des mesures de santé publique ont été levées, le port de masque reste obligatoire pour le moment. Nous examinons présentement la possibilité de cesser le port de masque obligatoire dans la province ainsi que d'autres mesures de sécurité. D'autres renseignements vous parviendront au cours des prochaines semaines. Limited protective measures are also in place, including requirements for indoor spaces to post signage at entryways, reminding individuals to not enter if they have symptoms or if they should be self-isolating, and requirements for workplace safety plans. These additional health and safety measures remain in place as added layers of protection to help reduce the risk of COVID-19 transmission. As you know, directives and letters of instruction have been put in place for multiple sectors. There's tremendous work and cooperation happening across government as we finalize the plans to transition to more operation with guidance and recommendations. That work is well underway, and the final stages as we look forward to sharing a path forward. We are also fortunate that our vaccination rollout continues to be strong. Currently, 90.6% of Ontarians over 12 years of age are vaccinated with 2 doses of a COVID-19 vaccine, and 92.6% have 1 dose. We have also administered 7 million third doses. This is an amazing effort that has protected Ontarians through the brunt of the Omicron wave, and a reminder that 3 doses can provide up to 95% protection against severe outcomes. We will also soon have another tool to fight COVID-19 in our vaccine toolbox. In late March, the Novavax vaccine will be available through public health units. Nous avons un autre outil pour combattre la COVID-19 dans notre boîte à outils. À la fin de mars, le vaccin Novavax sera disponible via les bureaux de santé publique. The Novavax COVID-19 vaccine is the first COVID-19 recombinant protein subunit vaccine authorized in Canada. This means it's the same type of vaccine product that we have used for decades in our regular immunization schedules for diseases like hepatitis and pertussis. Novavax is a 2-dose series that can be used also as a booster. We will have more detail regarding supply and access in the coming weeks. The Canadian vaccine Medicago has also recently been authorized by Health Canada, and we hope to have more information to share about that vaccine soon. Having additional vaccine products at our disposal will only help to increase our immunization rates, helping to further protect Ontarians from COVID-19. Des produits vaccinaux supplémentaires à notre disposition nous permettront d'augmenter notre taux d'immunisation, aidant ainsi à protéger davantage la population ontarienne contre la COVID-19. We continue our plan to reopen the province because of the positive trends we are seeing, the result of the hard work of Ontarians to get vaccinated and to follow public health measures in place. As part of our constant review of the data, it all remains stable or improving, we'll be looking at removing remaining measures as we lift requirements. I thank you, and I'm happy to take questions. Merci.
Dr. Moore, of course, the big question in many people's mind is the mandatory masking policy. There have been a lot of suggestions from the Premier, the Health Minister, that sometime around March break is when we could see them lifted. Can you provide us any further clarity on the exact date that they could be removed?
We don't have an exact date yet, Colin, but thanks very much for the question. So we've just reopened yesterday, and all of those large venues can now be at full capacity. We'll be monitoring the data in the coming weeks. I do agree with the Premier and the Minister that because the trends look so good that we can anticipate if the trends continue, removing mandatory masking by the end of March.
By the end of March. Okay. One of the things we're noticing is that the positivity rate is still rather high. I believe it's somewhere in the neighborhood of 10% or so. And you're saying that BA2 is now 30% more transmissible than Omicron itself. What is that going to do you think, to the case counts in this province? I mean, is it spreading at large, really undetected at this point?
Oh, thanks very much, Colin. I do want to ensure that Ontarians are aware the risk remains. We are removing measures over time, and that is because we have hospital capacity, we have capacity to care for Ontarians if necessary, we have ICU capacity, and we made the sacrifices in January to protect that capacity to care for Ontarians. We are removing measures because of the high vaccination rate, and we should celebrate 7 million Ontarians have now got their third dose. Around 90% over 12 years of age have had at least 2 doses, and because of that we can open up safely. That does not mean that the virus isn't going to try to continue to circulate, and there will be an ongoing risk in the coming weeks and months of this virus continuing to want to find those that are vulnerable, those that their immunity is fading and or that are immune suppressed. So together we will confront that challenge of the risk of ongoing transmission, and you're absolutely right, Colin, we're seeing it in the percent positivity, we're seeing it in the sewage positivity across Ontario. The risk remains, but it's at a much lower rate. I do believe the highest risk is behind us. We saw the risk of hospitalization peak at around the 3rd week of January, and we've had declining rates from 4,000 down to around 800 Ontarians in hospital now testing positive with COVID-19, but it does not mean the risk is gone, and hence the reason we're keeping masking and delaying removing that at a population level for the next couple of weeks as we follow the data.
Dr. Moore, last week you said almost in the same breath that masks are highly effective at preventing transmission, but also that we'll be getting rid of them soon. So why the discrepancy? If they're so effective, what is the rush to get rid of them?
Well, there's no rush because we are following the data and monitoring the situation very closely. So we would anticipate, as I've said, by the end of March, we'll have a declining risk. And after that time period, it will not be mandatory. But I ask all Ontarians, if you're vulnerable to this virus, if you haven't received your full dose of vaccine, first, second, third, or fourth dose, that you remain prudent, that we remain kind and considerate to those that decide to wear masks. I know this is is a change for all of us as we've been having that same messaging. I do believe they are protective. They do decrease your personal risk, but as the Chief Medical Officer of Health, we can only mandate masking for so long. As long as the risk is decreasing, we'll make a decision together as a province to remove them. But for those that are at high risk for this virus, I would suggest you continue to wear them, and that as a society we remain considerate, kind, respectful to those that decide to continue to wear them. As change management can be difficult through any pandemic, the removal of masks, I'm sure, will bring make some feel ill at ease, but also will allow others the freedom to not wear who may have already had COVID and or have had their second doses, third doses, and feel confident that they will not require hospitalization if they get ill.
You've also said that you wanted to lift some of the workplace vaccination policy mandates, like the directives for healthcare, education. Where are you at on that? Are those going to be lifting soon, or are they going to remain in place for a while longer?
So we have reviewed our directives, and we've reviewed the letters of instruction that we put in place. So as of March 1st, we have removed 2 letters of instruction, which were to have immunization policies for the Ontario Public Service, as well as the second was for our colleges and universities. I can say with great satisfaction that the colleges and universities had achieved in the high 90 rate of immunization of both their students and their staff, and have to thank them for implementing policies even before there was letter of instruction to provide the greatest level of safety for their environment. They've served their purpose, and letters of instruction have to be removed over time because they're part of the Reopening of Ontario Act, and we're reviewing all of them in the coming weeks and are building a schedule to remove them in partnership with the organizations that are affected.
Doctor, where are you still seeing increase in the wastewater indications? You were saying this last week as well. You were talking about some areas of northern Toronto and northern Ontario. Has anything changed? Are there any new areas? Is that BA2? Do you know?
So thank you so much. So a great resource for us is the Science Table website, and they have broken the sewage down to regions of Ontario. So you'll see, if you go there today, increasing counts across in northeastern Ontario. As well, you'll see it's not finalized yet, but indicators that the rates had stabilized and are just slowly going up in many regions across Ontario. And that's to be understood. We opened on the 17th more fully at 100% capacity, and now on March 1st for the large venues at 100% capacity, that we'd have ongoing risk of transmission at a community level. And so I think we'll see that most likely stabilize given the high level of protection of immunization. And Dr. Juni had intimated to me earlier that it's the Science Table's belief that 30 to 40% of Ontarians have had natural exposure to the virus and hence natural immunity. And some of that data is reflective of the ongoing detection in our sewage systems. We anticipate BA2 is taking over as a dominant strain in the Omicron group of BA1, 2, and 3, and that is happening internationally as well, given that it has a competitive advantage. It's more transmissible than its BA1, and we anticipate it being the dominant strain across Ontario by mid-March. I don't want to raise concern because we're not seeing any increased hospitalization from this. We do believe the vaccine provides a very strong benefit in preventing hospitalizations and severe outcomes against BA2, but that is what our surveillance is demonstrating at present.
Is there any chance that could change in terms of with the reopening? You know, when we've got people all jammed in at Scotiabank Centre, for example, at a Leafs game?
Well, it's a really good question. We because of our high immunization levels and 7 million Ontarians who are higher risk, so 86% of our over 70s have had their third doses, I don't anticipate that we'll have negative consequences from increased exposure to BA2, like increased hospitalizations. I do believe, due to the robust immunization strategy we have and the natural exposure that's already occurred, so 30 to 40% of Ontarians have had exposure to COVID, that combination of natural immunity plus vaccine immunity is building a strong wall of defense for Ontario against BA2 and potentially a recurrence of Delta. So that's good news from our vantage point, that again, enabling us to safely open in a staged and phased manner in Ontario.
Just a quickie, does BA2 make you any sicker than regular Omicron, or is it about the same?
Really good question. We're not seeing any increased risk of hospitalization. The only concern is that transmissibility factor, so it can spread quite quickly. And there are some studies that show a very small risk of reinfection. If you've had BA1, you can get a risk of reinfection with the BA2 variant, but that seems to be a very small proportion of all the cases.
Dr. Moore, I wanted to ask you about PCR testing eligibility. Recognizing that rapid tests, yes, are more available now for Ontarians, but we know they're not as good as PCR testing. Is the province going to open it back up again ever to the general public?
Well, I think you've recognized the multi-pronged strategy that we have in Ontario. So we still have a very robust PCR capacity. We're testing roughly 20,000 Ontarians on a daily basis and have been distributing around 5 million rapid antigen tests weekly across Ontario. And that combination, I think, is being able to provide Ontarians with the testing capacity that we need. We still need to keep a rapid turnaround time for our PCR, and I'm happy to say within 2 days we're getting in the mid-90s of results back for those high-risk settings, hospitalized patients as well as those in long-term care in retirement homes. So our current strategy is working very, very well. We always want to know that the sensitivity and specificity, how well that rapid antigen test works against Omicron, in that it's still an effective test to be used, and we're monitoring and we'll make recommendations if we think that we need to change back to increasing dependence on PCR. But at present, I think we have to recognize we've had a really robust testing strategy with the incorporation of the RATs.
Why not open it up? I mean, if the lab system isn't totally swamped right now, I recognize, yes, you want to prioritize for the higher risk groups, but I'm assuming that volume has come down as well. And even if you could explain, this is sort of a side question, you said you think 30 to 40% of Ontarians have had exposure to COVID-19. How would we know that, given that many, many Ontarians, especially in the last few months, haven't been able to get a PCR test?
Oh, so great question. The way we know that is we do ongoing seroprevalence studies, and so, for example, you would donate blood for the Canadian Blood Transfusion Service. Anonymous testing of that blood can show if you've got antibodies against natural infection or antibodies that have been induced by vaccination, and there's a difference in those antibodies. And when we do seroprevalence studies across Canada, we're seeing the level of protection against and natural immunity is building in an ongoing way. And there are also research groups across Canada. I think Quebec announced that they're very confident that children in Quebec, in Montreal in particular, had around 35% natural exposure to COVID. Those research groups are across Canada, and that has allowed the science table to provide that information to us, an estimation of 30 to 40% of all Ontarians have had natural exposure. But on the testing front, it's working well for us right now. We have good availability of RATs, we've got good turnaround time with PCR, and there will come a time when the incidence rate is so low that if you have a positive RAT test done at home, we will suggest you get a confirmatory PCR. So we're keeping that spare capacity for the time when, due to the low incidence, which could happen as soon as April or May, we would recommend a confirmatory test through PCR.
Okay, so just to clarify, that's not the current situation,
that is not
but that you're
correct.
hinting, suggesting that will change.
Yeah.
Again, I guess if you take a rapid test, if you get your hands on one, and it's negative, it doesn't mean you don't have COVID.
That's correct.
So why not let people go into an assessment center and get a PCR test?
It's not, well, it was the capacity that we wanted to maintain initially for the PCR and the turnaround time to allow us, because the turnaround time was getting to 3-4 days, so it wasn't actionable for outbreak management within long-term care sectors. So we're constantly getting feedback from the expert panel on testing of when we need confirmatory of RAT testings with PCR. We're not there yet, but we may get there in the coming weeks or months that we need confirmatory. Right now, a positive RAT in the community absolutely should be acceptable as a positive test. 2 negatives 24 hours apart is better suggestion that you do not have COVID-19. If you have ongoing symptoms, you should still stay home. There are other viruses circulating in Ontario right now. Rhinoviruses, adenoviruses, enteroviruses are still circulating right now and can cause very similar symptoms.
And we'll go to the phone lines for the last question.
From Cynthia Mulligan at City News.
Hello, Dr. Moore. Back to the wastewater for a moment. You've suggested that in some areas they're showing an increase, and I know that's not unexpected. But do you have a sense of what the actual numbers are? We know that we had roughly 2,200 cases confirmed today. What would the actual number be? Does the wastewater give you any sense of that?
Well, it's a good question for the modeling group. In my recent discussions with them have been that we could do a multiplication of around 10 times the PCR positivity. So if we're seeing 2,000 positive tests, 2,262 at a population estimate, we could be estimating around 20,000 Ontarians have COVID-19 today as we speak. That is building the combination of vaccine immunity and community immunity that we need to be able to slow this virus down.
Last question.
Okay. I think a lot of people would be quite shocked to hear that number. When we get to masking, I know in Alberta, Premier Kenney is moving to prevent municipalities from imposing their own separate public health restrictions. Would you recommend the same here? For example, if Toronto felt there was a concerning rise in cases, would they still be allowed to impose a mask mandate, even if it has been lifted across the province?
Well, really good discussion point. We have great relationships with our local public health agencies. Our regional associate chiefs are meeting with them on a regular basis. We've had regional approaches across Ontario, and that has worked for us. So we're in ongoing dialogue with all 34 regions of Ontario. At times, we've all had different approaches because of varying levels of activity, and we've been consulted at a central level to be able to provide that consultation locally. So that dialogue's been ongoing. It's been well received, and we have in Ontario had regional approaches. I don't think that approach will change, and should celebrate. Our local public health agencies work hand in glove with their local municipal government. So whether you put a recommendation in through a bylaw or a public health section order, we would be ready for consultation and support if there was a need.
Thanks, everyone.